Hello and welcome to The Vaccine. I'm Jeremy Fernandez. 6 weeks into lockdown and New South Wales has never had it so bad. The government there appears to have given up on achieving zero community transmission, at least for now. In a moment, we'll take a look at what that means for intensive care units as admissions to hospital keep climbing. And would you be more likely to get a vaccine if you were paid for it? We'll take a look at the proposal and what the data tells us about incentives. Well, once again, more than half the country's population is in lockdown. Victoria says it's in a precarious position as the state deals with an outbreak of the Delta variant. It's expected exposure sites will spread across Melbourne and into regional Victoria as the case numbers grow. There's better news in Queensland. Authorities there believe lockdown measures are working, but say it's still too early to ease restrictions. But the situation in New South Wales is still grim. It's recorded its highest daily number of cases ever, almost 300, and that number is expected to climb.
The health system is under stress, as you'd expect, because there are a number of cases that are coming into our hospitals, and obviously there are patients being cared for.
Our reporter Ursula Malone is in Sydney and joins us now. Ursula, the New South Wales Premier says the flattening of the curve they were hoping for just isn't happening.
Sadly, that's right, Jeremy. I've been having a look back at the figures for this week, and if we take a look at those figures, it was 207 new cases on Monday. Then on Tuesday, there was a ray of hope as the cases dipped just below 200 at 199. But by Wednesday, they were back over 200 again, 233. Yesterday, it got up to 262, and then today, 291 cases. That's the highest number we've seen yet in this outbreak. Now, that makes a total of 4,610 cases since the middle of June. And worryingly, we're still seeing a large number of those cases were out and about in the community during the period that they were infectious. Now, and there was a warning from the New South Wales Premier today that we should expect to see those high numbers continue over the next few days. Now, sadly, there was another death to report. A woman in her 60s has died at Liverpool Hospital in southwest Sydney. It's believed that she contracted the virus from a staff member at the hospital, and it's the second death connected with that outbreak at the hospital. Now, there were 2 new cases reported in Newcastle, which brings to 7 the total number of cases there, but no new cases found on the Central Coast, so the total there remains at 9. Now, as you mentioned, there was a candid admission today, the first time we've really heard this, that the health system in New South Wales is under strain. And the Premier said it's really the Delta strain that is so much more infectious. That's really what's putting the health system under such strain as more people are being admitted to hospital with COVID. And one example she gave was that at a single KFC outlet in southwest Sydney, 12 staff members there have all tested positive for COVID.
Ursula Malone reporting, thank you. Let's bring in Mark Nicholls, who's an ICU doctor and the Vice President of the Australian and New Zealand Intensive Care Society. Mark Nicholls, welcome to the program. We've just heard the New South Wales Health Minister make that admission today that the health system is unsurprisingly under a lot of stress right now. Where should that leave the public's confidence in hospitals right now as this surge continues to grow?
To be honest, I think we should be confident. I mean, we've got a world-class hospital system and a world-class intensive care sort of system as well. And we've been planning for this since the pandemic started. So just with my society, so the Australian and New Zealand Intensive Care Society, we've been planning back at the end of January. We provided the surge capacity data to the government in February. That was last year. And then a group of around 50 intensive care specialists across the country were involved in writing guidelines that were informative for every hospital across the country in terms of surging, in terms of pandemic planning. So sort of a tiered approach to as numbers increase. And also the initial guidelines had a focus on staff safety and well-being. So we had a sustainable workforce.
You've treated patients who've got COVID. What condition are they in when they arrive in hospital, and how do you go about trying to save them?
80% of patients will stay home, and about 20% of patients will end up needing to come to hospital. So they identify those patients. And then those patients get admitted to hospital, and then they get started on oxygen. And then some of those patients have increasing oxygen requirements and then need to move to the intensive care unit for closer observation. And so we've got a phased ability to watch patients coming as they deteriorate. And if the patients deteriorate further in intensive care, we use things such as high flow nasal oxygen, non-invasive ventilation, and in some cases, in 30% of cases, we end up actually intubating the patients. And that's where we put a tube into the mouth with a cuff and then connect them to a ventilator.
These are pretty confronting circumstances, and we're seeing this occur to younger and younger patients as well, aren't we?
Yeah, to be honest, this is something that we've done all our working careers. So looking after the sickest of patients is something that intensive care specialists and intensive care nurses have done the whole of their professional working lives. And so it's something that we've developed a set of skills and abilities to do that. Yes, this is unprecedented. Yes, we're in the middle of a pandemic, and ultimately intensive care is at the forefront in a sense, because we will get those sickest patients, but we have put plans in place, and we're ready for surging. But this ultimately comes down to everybody in the community has to be responsible and has to help the hospital system and has to help the intensive care units. And the way they do that is they need to, when they have an opportunity, is to get vaccinated.
A woman in her 60s has died after contracting COVID at Liverpool Hospital in Sydney. How effectively can people who are going to hospital with other comorbidities, other conditions, suppressed immune systems, be shielded and protected from outbreaks at places like Liverpool Hospital?
There's a number of ways in which you shield patients who don't have COVID from being infected. And so that's part of what we call administrative controls. And also environmental controls. So what we do is we end up with certain workflows at the point of admission to hospital, for instance, to the emergency department, and then patients, if they've got respiratory symptoms, will be assumed to have COVID to be proved otherwise. And if they're not, then they get put into a place that has a low incidence or low chance of having COVID. And so that's how we're protecting people within the emergency department, but there's also similar processes throughout the hospital, including intensive care. So in intensive care, we have, what we will do is we'll have a dedicated space, a dedicated area where we look after the patients with COVID, and then we'll have a dedicated space where we look after patients who don't have COVID, who've got other medical conditions that we need to look after in intensive care.
Mark Nicholls, it's so good to talk to you. Thank you.
My pleasure.
As we've heard, healthcare workers and leaders across the country are pleading for more people to get vaccinated. Dr Katie Atwell from the University of Western Australia specialises in vaccination policy, and she joins us now. Dr Atwell, thank you for joining us. 80% is the magic number that National Cabinet has agreed to. Is that a realistic level of uptake?
Well, at this point, clearly not, because we don't have supply for those people yet. I'm hopeful, I remain hopeful that we can get up there through a range of strategies, but it is going to be a challenge.
And when can we get there?
Well, that's really going to be a question of supply. It's really going to be about having those vaccines here in the country for the younger population, for whom in most states are still being recommended to wait for Pfizer.
Talk me through some of those strategies you mentioned, because one of the ideas being floated right now is this idea of paying people to get vaccinated. Do incentives like that work?
They've been used historically in this country for childhood vaccination, but in a way where people who didn't want to vaccinate and were able to opt out could still actually access those resources as well. So the issue here is whether an incentive feels like a bribe to people. And certainly the research we've done in Western Australia through our CoronaVax project has indicated that some people feel quite uncomfortable with the idea of an incentive, particularly if it's a fairly large amount of money, which I guess $300 is for a lot of people. if that's going to make you do something you wouldn't otherwise do, that doesn't seem like a very good way to engage in public health or pro-social behaviour.
What about the non-financial incentive? I mean, the risk profile, particularly for a place like New South Wales right now, is elevated. Does that influence the uptake?
It absolutely does, and so does the changing advice. So, for example, the fact that younger people are now recommended in New South Wales to get whatever vaccine they can, which predominantly would be AstraZeneca. So changing risk profile, changing advice does encourage people to go and get vaccinated. But even people I'm talking to here in Western Australia, where they might not be able to get their hands on Pfizer yet, I do know also of young people who are going out to get AstraZeneca as well.
And that's despite the level of risk in the community right now in WA being a fair bit lower than it is in New South Wales.
That's right. But I mean, we just had a little scare. There was a guy who had a weak positive case. We all see where this guy's been. And of course, whenever you find out about these people, they seem like they've been everywhere. So, you know, I feel like we're a whisker away from being in this sort of situation of our eastern states counterparts. And I imagine a lot of other West Australians feel the same.
The Prime Minister is saying he trusts Australians to understand the necessity of getting vaccinated without a financial incentive. You've researched the issue of trust and lifestyle-based hesitancy. What have you learned about the barrier they pose and how to get around that?
So I would say that the situation we're facing with COVID vaccines is different from the vaccine hesitancy and refusal I've researched in the past with parents who were quite fringe and alternative lifestyle in their beliefs, rejecting various other forms of medication or mainstream schooling, things like that. We're seeing larger numbers of people being hesitant around the COVID vaccines, understandably because they still feel like the vaccines are new. And of course, as we've already talked about in Australia, people are not necessarily feeling as under siege from the disease itself. So the vaccine might feel scary, even though if we kind of are in a setting where the disease is around, the disease pretty soon starts to feel incredibly scary as well, much more scary. So I would say that the hesitancy we're looking at for COVID-19 vaccines needs to be dealt with by having clear communication and information. And this is really close to my heart, actually, because this morning I just spent a couple of hours doing focus groups with women from diverse cultural backgrounds in the northern suburbs of Perth. And the lack of information these women are encountering and the hesitancy that's moving around their circles was really sobering to encounter, and just really brought home to me how much work government needs to do to make sure that these people who are not fluent in English are able to access information about vaccine safety, about why they should be vaccinated, about how to get vaccinated, how to engage with booking systems. We need to make it so much easier for people.
Now, what role does business have here? You will have heard of SPC, the fruit canning company, announcing it will insist on all staff and visitors being vaccinated, I think, by the end of the year. What do you think about that mandating of vaccines?
So my position on mandates is that they are better when they're brought in by government rather than by companies. When it's government telling companies to do it, I think that has a stronger message. I also think that it has more legitimacy because we're accountable. Our governments are elected by us, so they have a higher level of legitimacy. When companies do it, it may create risk of reactance and pushback from their staff, although that's not to say that certain staff wouldn't need to be vaccinated in particular settings. But this SPC case will be the first of its kind in the country, and we'll have to see whether the employees are happy to be vaccinated. I certainly think that the measures SPC are taking with regard to giving their staff time off to be vaccinated and time off if they should pull up a little bit sore or a little bit unwell the next day is exactly the kind of measure we want to be seeing. And I'd like to see businesses introducing those sorts of measures to support vaccination in their staff, regardless of whether they're mandating it. In fact, putting those policies in place first is a way of really making sure that people are vaccinated under conditions that feel voluntary and feel good for them. And that should be our first goal.
Dr. Katie Atwell, it's so good to have you with us. Thank you so much for joining us.
Thanks for having me on the show.
And that is the vaccine for this week. You can catch up with the show anytime on iView and the ABC's YouTube channel as well. Thanks for joining us. Stay safe.